Hi, everyone. This is Dr. King Chung from Northern Illinois University. I'm an audiology professor, and I have been involved in quite many humanitarian research and hearing services in the past 12 years. And it is a pleasure and an honor to be invited to talk about something that is near and dear to my heart. So for this presentation, I would like to talk about the importance of hearing and based on recent research, and then I would like to draw your attention to the ear and hearing needs of different populations around the world, especially the Ukrainian refugees. And at the end, I hope to reinforce our belief to help people to connect with other people. The Lancet Commission 2017, they set out to find the risk factors that is associated with dementia and cognitive decline. What they found is that if someone has hearing loss in midlife, it is the biggest modifiable risk factor for developing dementia or cognitive decline. That means if we have hearing loss and we just really need to take care of that. And Anu Sharma gave a talk, last year, and then on the neurocognitive brain changes in hearing loss. And she and her students conducted a series of studies, and then they explored what happens when you stimulate the fingers, or their participants see things, what happens. And what they found out is that for people with normal hearing, then when the fingers are stimulated, the area that will light up in the brain is localized to the area it's supposed to process somatosensory stimuli. However, if people have hearing loss, then they would recruit the auditory cortex in processing that same stimuli. And then they also found out that when that reorganization happens, then when people are tested with the speech and hearing test, their performance are actually worse. So the more the reorganization, the less they would understand in noise. And then this also happens in the visual cortex. So when a visual cue is presented, then the auditory cortex is summoned for processing that signal. But the good news is that if someone wears hearing aids, just after about 6 months, then their brain would be reorganized. So visual cues is processed in the visual cortex and no longer in the primary auditory cortex. And then also the somatosensory stimuli will also be localized to the area that process somatosensory stimuli instead of in the primary auditory cortex. This brings us to say, okay, if hearing loss, and then we need to take care of, and then how about if we wear amplification? Would that affect our cognitive ability? And I know a lot of people are waiting for Franklin Lynn's study on whether amplification would be able to slow down the cognitive function or not. And I think Yale et al., they beat that, and then they conducted a systematic review and meta-analysis, including 137,000 people. And then they found out that if people use hearing restorative devices, which is hearing aids or cochlear implants, it is associated with 19% decrease in the hazard of developing cognitive decline. such as dementia, over a duration from 2 to 25 years. And then if they wear hearing aids or cochlear implant, it is also associated with 3% improvement in the cognitive scores in the short term. So I think it is pretty clear that if we have a hearing loss, we really need to take care of that. Unfortunately, in the world, there are quite many people have hearing loss, and then about 1.15 billion people have mild hearing loss, and then moderate hearing loss is about 266 million. And as the hearing loss grows more profound or more severe, then less and less people have those have those type degree of hearing loss. And I point the arrow here is because in the WHO's publication, these numbers are very different. And then I recalculated the percentages, and actually it is 72% that would have mild hearing loss in the better ear, and then 16.8% would have moderate hearing loss. So mild to moderate hearing loss, it is about 90% of the hearing loss in the world is between mild to moderate. Well, this slide was a slide just showing that about 60% of the hearing loss in kids is due to preventable causes. And in the high income countries, that is about 49%. And then in the mid to low income countries, that is about 75%. That means a lot of education needs to be done. And then in order to prevent having hearing loss, and vaccine is one of the things, and then also noise and head injury, they need to be aware those are not good for the hearing. And then also ototoxic drugs. There's still some countries, they are using ototoxic drugs to treat malaria because it is cheap. But they do have more expensive alternatives, but then they're just not using it because those are more expensive. So this also, it is the education is also needed, and a lot of help to educate the providers. It is important. It's needed, and also the government should also be aware that although the drugs are cheap, but then it is not good for the person in the long run. And then thinking about hearing loss and age, and if I think a lot of the countries that have newborn hearing screenings already, and then they are catching quite a small percentage of kids with a hearing loss, although it is very important to catch those. And then as the kids age and more kids would have hearing loss, it is so this brings up the importance of school screening, and then also involving so the school screening should not only be limited to finding permanent hearing loss, because there are some not permanent hearing loss like middle ear problems can be, if they can be detected, and then they can also prevent other hearing disorder or processing disorders in kids. And as people age and inevitably they would have more hearing loss. And then when they get to be more than 95 years old, then they would have, 58% of them would have hearing loss. And I also want to draw attention to the global prevalence of hearing loss. And if you count all the lower middle and then upper middle income countries, they are about 80% of the people with disabling hearing loss is living in the low to mid income countries. And then the high income countries, they have higher prevalence. But then the number is only about 20% of the world population with hearing loss, not the whole population, but it is the people with hearing loss. So this brings up to the groups that I want to highlight is that, people living in low to mid-income countries, they would need special attention, and also older adults. As people get older, and then they would more likely to have hearing loss. And definitely kids are in this category too, but the prevalence is not as great as the older adults. And it is good that WHO just published hearing screening guidelines so that they would want people to screen newborns, definitely, and then children, and also adults. And then they say, well, in between, and then if it is middle age, and then they should have, targeted screening. But they do recommend population screening in the two ends of the lifespan. This also brings up to, our work in the world. So through the years, we have been to quite many countries, and then with different groups of students. And then the data is really, collected by all of these wonderful students, and then who have the heart to help other people and to find out the hearing status of different populations in those countries. And when we go out, and then we always do otoscopy, and then also do otoacoustic emissions. And then we also would check would conduct a tympanometry that would check the middle ear status. So this aeroscan does both the tympanometry and also otoacoustic emissions. It does have reflex capabilities, but the thing is that we have not been using it consistently, and then sometimes it takes a lot of time to get the reflexes. When we are trying to do all four reflexes, it takes a lot of time. And if the kids fail, or if the individual fail otoacoustic emissions, then we would conduct a pure tone audiometry. And then we usually use those insert earphones or the Kudo wave because they have very high noise attenuation properties. So just to see, this is the ANSI standard from 2099, and then it is reaffirmed in 2018. And the Kudo wave data was from a study conducted by Swanepoel, and then these ones shows that at different frequency bands, if you use the octave band, then the insert earphones actually have quite significant amount of noise attenuation compared to the superaural. So the higher the number, the more the noise the environments can have, and still allowed people to test down to 0 dBHL. So if you think about insert earphone, and then these numbers are much higher than the superaural headphones or the bone conductor or sound field testing requirements. And when you add the Kudo wave, because it has the insert earphones, and then it has this additional ear cup, then it will further reduce the background noise for another 0. This is a 0. This one is about 6 dB, 10 dB, and would have several dB higher of attenuation than the insert earphones. So this makes it possible to just test bone conduction in an office space. So it is a very good tool for using in the field. So after each trip, and then we usually come back to have several to analyze the clinical findings and then also disseminate the information. So our, this scrapbook is definitely something that is really fun, and then we all do that, together, and we have a book for each year. The pictures that you saw in the beginning, some slides ago, they were the scrapbook. Their scrapbook covers. And then we also publish in professional magazines. And then we also publish it in peer review journals. And the news release was just really new, that was used to raise awareness of the Ukrainian refugees' hearing loss. And then we were hoping that if we raise the awareness, then we will other people are going to support the hearing tests for the Ukrainian refugees in their country, or in the US. There are also two manufacturers chain. They are offering lifetime hearing aids warranties and free hearing aids for the Ukrainian people. So we are using the news release for the raising awareness and the urgent need, because they have urgent needs. So, well, go back to the populations that need special attentions. So when we were in Taiwan, we tested quite many people, and then the special ed school has a lot of failures. So this is a special ed school that they have pretty severe disabilities, and then a lot of them have wax. So the wax and wax only. So wax plus means that they have wax and they have other things that, more than the wax. And then this is the wax. So the earwax is a big problem. And then as you can see, they are, pretty prevalent in, many people fail because of that. And the wax that we are talking about is not like the wax that you can it will just come out by itself. It's either, very much occluding the ear canal, or it is totally occluding the ear canal. The wax marking is for someone who would need professional cleaning in order for the wax to come out. So, and then you can see that the special ed school has a very low passing rate. And then the care home is also the care home for adults with special needs. They also have a lot of wax, and then a lot of failure, and then also the passing rate is low. And then the community center is mainly for the adults, and then we can see that a lot of them have hearing loss, and then quite many of them has hearing loss and wax problem. The passing rate is super low. And the Harmony Home and the Harmony Child, adult and child, they are the people with HIV positive status. So in Taiwan at that time, people would be will be disowned by their family, so then they live in group homes. And then we can see that the passing rate is also very low. And when we go to Hong Kong, then the special ed school is a little bit better. So for the kids, they mostly live at home. And then these are the kids with less severe disabilities. And then they actually have a higher passing rate. And then compared to the adults in the day center, which they had special needs, then they have a very low passing rates, just like in Taiwan. And they also have a lot of wax problems, and then also wax plus problems. So then, well, from these two countries that we can see that people really, when they have intellectual disabilities or any disabilities, they have very low passing rate. The same thing we found out in Brazil. So when they have disability, whether they live in a group home, well, if they live in a group home, the passing rate is especially low. So if they live at home with a mom and dad taking care of them, it's a little bit better. So this is with the mom and dad taking care of the kids, and then they also have lower, lesser degree of disability, then they tend to fare better. And then we also tested the drug rehab centers, and then that just shows that, although people may abuse drugs, they actually don't have hearing loss. Those are adults, so they are actually okay. And then in Brazil, we also tested kids in impoverished areas. So then that is actually linked to the next set of data that I want to share. And before that, I want to add children and adults with special needs, especially if they live in group homes or live in all-day schools, then boarding schools, they have a really, really high need for hearing services. And then here is talking about this, this shows the socioeconomic status is actually related to the kids' hearing too. This study was done in 2016 and 17. In 2016, we went to a seaside community with Aboriginal kids, and they were from preschool to high school. And then we tested them, and then we were like, oh my gosh, what is going on? They are normally developing children, but they are Aboriginal children. They are about 1.5 hours from Cairns in a seaside community, and the passing rate is very low, and they have a lot of middle ear problems, which I think Australian government and Australian Hearing is well aware of that, and then they have been doing a lot of work to try to resolve that. And then, but we also, in the following year, which is 2017, we went to a mountainous area which has middle income, and they are also Aboriginal children. But the thing is that the passing rate is a lot higher. So then this shows that the ability to access healthcare and also the socioeconomic status would affect hearing, and especially in the Aboriginal communities. And from a slide before, you can see that for children living in impoverished areas, in Brazil they also have more hearing loss. And then the wax problem, more hearing problems, and then they have less of a passing rate. That brings me to the fourth group of people or individuals that will need special attention, which are the Aboriginal children and children living in poor areas, and especially those with low economic status and living in remote areas, they cannot access health care. That is something that we need to take care of. So the most recent trip was to go to Poland. This one is something that is a serendipity, because last year there was an international Congress of Hearing. No, in the International Audiology Congress was held in Warsaw, and then my chair knows a professor who comes to NIU, and then he has some studies going on. And then my chair said that, whoa, why don't you go to visit them and then see if we can take students to go to Poland. So then I just went to Krakow, and you plan to go to Krakow. And then the war broke in February, and then the conference was in April. So I heard of so many refugees were fleeing the country and they are displaced, and then a lot of them are staying in Poland. So during the International Congress of Audiology, is it International Congress of Audiology? Yeah, conference. Then I went to Krakow, visited the professor, and then I also check out on the internet and then to see where the refugees would be, and then I went to a shopping mall where they were living, and then tried to contact people, and then later, then I got in touch with the Jewish Community Center, and they were helping us to reach the refugees in the area. So we got to see them in 2 hotels, and then tested about 180 some 80 68 people. I used about is because there were 4 or 5 people in this group. They may be they belong to the Jewish Community Center, and we do not know who's who. So then, we just say, okay, so we do not know who's who. So that's why we cannot separate the Jewish Community Center's staff from the refugees. But I think there were only 4 or 5 of them are in this crowd. So this one is the main square in Krakow, and then we were testing the refugees in one of the community centers. No, in one of the hotels that they stay, and then this one it was in another hotel, and then the Jewish Community Center personnel, they were helping us to do the translation, and then we were talking with them about this. For this picture, it was specifically for counseling. This one was testing, and then also testing and instructing them. And then we tested 100, and this one is 168 people, and then about 30% of them, the adults, had war-related hearing loss. So about 14 of the ears by different people had wax needing professional cleaning, and about 14 ears had type C tympanograms. So when we were testing them, and then they came and then with their families, and a lot of them were women and older men. It is because the younger men, they were mandated to stay inside to fight. So what we saw was a lot of kids, so a lot of children, and a lot of adults, older adults and women. So when we were testing them, we did not specifically ask them whether they, what happened. And we would just say, okay, if we see someone with asymmetric hearing loss, and then we would say, okay, is there any reason that you have one ear has better hearing than the other? And then they would just, tell us, okay, why. And there was a gentleman said that he and his son was in a bombing, and then he fell onto the left side. So then his left side, actually what we tested out was that his left side had less hearing than his right hand side. So because his right side was not protected, but then the left hand side, because it was on the ground, so then it was actually sort of protected. But then we did find an asymmetric hearing loss. And with the gentleman, none of the people, so when I was listening to the story, and then I was asking, oh, what happened to your son, because obviously he's there, but then his son was not here. Then the JCC people said that, well, no one dared to ask him, because every time, he he mentioned about this, and then he's very sad. So we just don't want to trigger it. So no one knew what happened to the son, but we found an asymmetric hearing loss because of that, because of the bombing. And then we also found that there are some people with perforated eardrums. Some of them you can see that there's a hole there, but then, when you test their tympanometry, then they actually have type A tympanogram. So that means it's healed, but, we have seen quite many people, maybe several people with perforated eardrums. And then all in all, about 30% of them we can identify, either they volunteer or, when we ask them why they have asymmetric hearing loss, then they volunteer the information to say that it was because they were in the war. So then, well, luckily, among the 15 kids that we tested, they only have type C tympanograms. So then they were not, that probably was because it was getting into the middle of the winter. So that's why they have a cold or so. Then we gave them a sheet to ask the parents to monitor their hearing. So if there's anything happen, please go take them to see the doctor. So if they have fever or they have ear pain, then go see the doctor. Because of this large number of people with hearing loss, so they came not because anyone promised them hearing aids. It was just, the JCC was the Jewish Community Center, just said that, oh, if you want your hearing to be tested, please come please let us know, and then we can schedule you to, for a time to come. So we didn't promise hearing aids at all. And certainly this is not a population study. They volunteer to come, but still it is something that the number of people with hearing loss is astounding. And then we were really saddened by the stories that we heard. And then, so when we came back, then, okay, this one is the hearing loss that we found that I just analyzed, like this afternoon or so. So, and the dots are the maximum, these dots are the minimum for the people who have hearing loss. So if they don't have hearing loss, then we would not, they were not included in here. So hearing loss, what we defined it is about at 2 frequencies, if they're more than 20, no, more than 25 at 2 frequencies, then we would count it as having a hearing loss. But then for aidable hearing loss, that's a different count. So then it would be like, okay, if you only have like 20, 30 and 30, 30 dB and 30 dB at 4,000 and 8,000, we are not counting it as aidable hearing loss. They probably don't need hearing aids. So it would have to be more severe, and then like getting into 45 and then 50 dB at 2 frequencies, or 40 at many frequencies, or 35 at many frequencies, then we count it as aidable, people with aidable hearing loss. Then the error bars are the standard deviation and the maximum and the minimum. And the error bars of the right ear, I just could not add it. I tried many times, but then the error bars are about the same size as on the left-hand side. So after we came back, then we said, wow, the hearing loss is, the number of people having hearing loss is so overwhelming. We have to do something about it. And really, also it is, prompted by the studies, the recent studies that show that it is really important for people with hearing loss to take care of the hearing loss. So after we came back, and then we refocused our mission to fitting hearing aids. So before we were thinking, okay, we will test in the same trip, in the November trip, we tested the refugees, and we also tested children, Polish children in a private school. So we were thinking of going back in March, means in about 10 days, that we were going to go to test children in a public school so that we can see whether there's any difference in the prevalence of hearing loss between the two populations. So the primary school was the private school was we tested everyone. So we were planning to go back to the public school to test everyone. So that would be a public, public um, population study. But because of the overwhelming number of people with hearing loss, then we said, well, we got to take care of that. So after we came back, and then I wrote a news release to raise the awareness. And then I was also, hoping that someone in the audiology community will donate hearing aids to us so that we can go back to fit them with the hearing aids. And fortunately, that one of my former students who is working at a manufacturer's company, and then she said, well, we have some hearing aids that we just got done with them with a study, and then they were just really lightly used, maybe only 2 to 4 months. And then, do you want those? And then I said, wow, it will be great. That's super. And then we specifically asked for rechargeable hearing aids because we don't want the refugees, when they are displaced in another country, and I am assuming that they have limited income and they would need to buy batteries. So we thought that the rechargeable hearing aids would increase the chance that they actually use the hearing aids. So that's why we asked for the rechargeable, and the students later said that, wow, we actually got 112 hearing aids for you. So that's the number of people that we counted with aidable hearing loss. So then we were very, very grateful that the manufacturer was able to donate those hearing aids to us. And then in the because before we did not fit hearing aids in our trips, and then we mostly do surveillance of their hearing status, and then we let the local collaborators to take care of their hearing needs. So if they need medical treatment or if they need hearing aids, and then our local collaborators would follow up with them. But this one, we know that in Poland, the refugees actually would be able to get all the health benefits as a as a Polish person. But the thing is that the Polish system does not buy hearing aids for the people. So even the Polish people, they need to buy their own hearing aids. And then again, thinking about how much resources the refugees would have, then we decided, okay, we will go back to give the hearing aids to them, and then make it the best possible scenario so that they would wear the hearing aids. And we then we try to get all the equipment ready for hearing tests and then for ROEA measurements. So we're taking the Kudo wave over and to retest them, the AC and BC, and also we are taking the REM, the ROEA measurement systems to go there and to fit the hearing aids. And we also have generated all the instruction, the user manuals, put them in English, and then on the other side it's sort of like a table, one side English and then the other side is Ukrainian, and then we have a Ukrainian translator to read over the Google translated instructions so that it really means what it means. So then it would not be like the awkwardly Google translated um, instructions. So we try to make sure that they are in fluent and proper Ukrainians language. So and then also in one of the preparation is also to try to make sure that their hearing aids have the is able to connect with the remote fitting software that that Resound has. So we are hoping that at the end they would be able to receive services from their public health system because now they do have hearing aids and then they should be able to get free hearing services. But in the meantime, and when we are not there yet, not there, after we fit the hearing aids and before we go back, and then in that period, we want to be able to remote fit them or remote adjust them. Not fitting. Fitting needs to be in person if it is the first time, but then to be able to adjust the hearing aids if they have any problems, so that we can provide some services in between. And we also launched a campaign to support the students to go to Poland, and also communicated with different nonprofit organization so that they can help us to help the refugees. So we started with the JCC, and then after we came back, they said that they have switched their focus a little bit, and then they could not support our activities. So then they contacted another nonprofit organization, and then they would have the room that would be able to lend us so that we can use their offices and the conference room to do the fitting. So that organization is a Committee for Defense of Democracy. And they said their organization mainly organize promotions and also demonstrations. So we will be willing, or we will be curious to know more about their work too. So and I have to say that in this whole process, our collaborators in Krakow is very, very helpful, and then we actually rely on them to contact the refugees we identified with hearing with aidable hearing loss. And then we say, okay, can you contact them and then see if they're still in Krakow and if they would like to use hearing aids. So we definitely do not want to give hearing aids to someone who thinks that they are okay without the hearing aids. That is just going to set up for, in the drawer hearing aids. So then the JCC also help us to contact them, to schedule them to come back at what time, and then to do the hearing aid fitting. And JCC, they were very grateful, they were very graceful that we were, and they were helping us to find translators, because when we do the hearing fitting, we need to talk to them more than just doing hearing tests. So they are also helping us to find the translators. So the local support is very, very important. And we will for this March trip, we'll join force with the University of Sao Paulo and the Federal University of Bahia, to go to fit the hearing aids. And the plan is to fit 43 refugees and one Holocaust survivor with the hearing aids. So the Holocaust survivor is a member at the JCC, and then they said, well, can she get fitted with hearing aids? And then we said definitely. And then we are also planning to go back in June 2023 to provide follow-up services so that we, for any of the hearing aid fitting services, we cannot just go one time because there are bound to be problems or things that we will need to do fine-tuning. Hopefully we will be able to see all of them again, but then again, they might not be in the area anymore, but we hope that if they have the hearing aids and then they can also get services somewhere else. And we also plan to go in November 2023 to provide follow-up services to the refugees and also finally to test the public school children. And then we pick that time is because time can also affect the prevalence of hearing loss. So then if we're comparing the two groups, the private group and the public school group, then we want to be at about the same temperature. So or the same time of the year. So that makes the June trip not possible to test the public school kids. And so that's the final group of people that I want to add to this list that I hope everyone will pay more attention to them. And I know in many people in this list, everyone is paying attention to them already. And I hope the data from different countries is also going to assure that, these populations would need more services, and please do help. And there's a final note about this one is that the need out there is always bigger than what we individually can meet. So please help others, help people in need. So this help can be financial, it can be connection, and can be equipment. So for me, I have a pretty big network of international collaborators or colleagues that I can call for. So if you're interested in helping refugees in Poland or in other countries, or even in your own countries, and then if it is possible in your own country to provide free hearing services, that will be great. And I'm not sure about what Australian hearing is doing for them. And then if you guys can also provide free hearing services for them, and then that will be awesome. And I know two hearing aid manufacturers chains are providing free hearing services in the US. And then I also saw that there was an Ireland hearing center. They were also providing free hearing services for them, but then they do not provide hearing aids to them. And I recently just got to know that in Germany, Switzerland, and also Austria, they also have refugees. So if anyone is interested in connecting with them, or to go with us to service them, to provide service to them, you're welcome, and please contact me. And at last, the two organizations, there are great, two places there are great for you to find information about humanitarian audiology. One is the Audiology Without Borders, that is a column in Hearing Journal. And then another one is the Global Coalition for Hearing Health. That is an organization. They have a meeting in October this year, and then they will be in, I think, Los Angeles. So it is a great time to connect with other people, and then also connect with, to get to know people to provide, who will provide humanitarian services. Then at the end, I want to end with this quote from Helen Keller. She said, blindness separates people, from things. Deafness separates people from people. And I would say everyone deserves to connect with other people. Please help them here. Thank you.